Diabetic eye disease is a significant burden. We know that there are over 30 million people in the United States with diabetes, and many of them will develop some form of diabetic eye disease, whether it's diabetic retinopathy or diabetic macular edema. And when this becomes sight-threatening, this can really become a significant burden for our members and, of course, for patients in general with diabetes. In terms of the impact of diabetic eye disease on the cost of care for diabetes, we know this is a very expensive complication. And first of all, we have the cost of caring for the member directly, the cost of medical care, and then there's the secondary costs, which is lost productivity, and taken to its extreme, if somebody goes blind, the cost that goes with caring for somebody once they've lost their sight. The cost in the United States is estimated to run possibly as high as $500 million a year. So this is a significant financial burden on society. Diabetic eye disease really provides an opportunity for a disease state to be impacted by medical care ahead of time. So all too often, the medical system has to respond to significant problems. Somebody develops a problem, they need their appendix out. Well, nobody goes and gets their appendix out beforehand. We wait until there's a problem. But with diabetic eye disease, because of screening, we know that we can identify this type of disease well before it becomes a problem and make sure that it gets treated to hopefully prevent a significant problem to sight and at the very least minimize it. And so the major first step that can be involved in taking care of somebody with diabetes and to protect their eyes is to make sure that they're getting screened. Unfortunately, we also know that many people don't take advantage of this opportunity, and roughly, depending on the population we look at, only about half of all folks with diabetes get screened every year, and in some populations that rate is even lower. On top of that, we know that there are many people, possibly a quarter of all folks with diabetes, don't even know they have diabetes, so of course they're not being screened at all.